Hello, my Red Tribe, and welcome to another episode of Dr. Red Diaries. Welcome. So today we'll be talking about a very, very important topic, which is maternal mortality in Nigeria. This topic is something that is urgent, is important, and is urgent. And I think it's one topic that people don't talk about. We just talk about it in passing. Women are dying. Oh, they die during childbirth. Nigeria. We just talk about it in passing, but we don't really address certain issues or address it in depth to even know exactly what is maternal mortality. Why are a lot of women still dying during childbirth while during delivery in Nigeria? Okay, now let me tell you a story, a very short story. Let me tell you about a lady called, let's call her Chioma. So Chioma, she was 28 years old. She was healthy, excited, pregnant with her first child. She attended antenatal care, although let's say not consistently. The hospital was far, and it's most likely it was far because the ones nearby, maybe they are health centers that don't really offer antenatal services, or they are hospitals that she could not afford. Maybe they are quite expensive. Transportation was expensive. She's working and her work was demanding. So just picture that in mind. So one day she went into labor and it was in the night. She went to the first hospital. They could not accept her. Why? Because they don't have the equipment to be able to perform delivery. And then she got to the second hospital. Oh, rewind back. When she went into labor, a complication happened. She started bleeding. So fast forward. First hospital could not attend to her. There's already complications. She's bleeding and they don't have the amenities to manage such complications. She went to the second hospital. The same thing. They delayed her, kept her waiting, still had to refer her out. Before she got to the third hospital, it was too late. The baby survived because she gave birth as she's about to enter the hospital. In fact, on the road, on the way, baby survived, but she died. So this story I'm telling you, I just mentioned right now, is not a rare story. It is a Nigerian story, and a very common one at that. Let's talk about maternal mortality in Nigeria. Nigeria has one of the highest rates of maternal mortality in the world. Nigeria has the highest. I think maybe Nigeria might be I think it's number 2 or so. And recently, the Global Health Report estimated that Nigeria accounts for a significant proportion of global maternal deaths each year. Women are dying from preventable causes: severe bleeding, high blood pressure that will lead to preeclampsia or eclampsia, infection, obstructed labor, cervical incontinence, unsafe abortion, and so on and so forth. And most of these cases are not just preventable, they are treatable. So why are women still dying? So let's go in depth into this matter. So there is this framework in public health called the 3 days or 3 delay model. Yes, 3 delay model, that's what it's called. And it explains a lot about Nigeria. So the first one is called delay in deciding to seek care. The second one is delay in reaching the care. And the third one is delay in receiving the care. So let's talk about the first one. Delay in deciding to seek care. Sometimes it can be maybe the symptoms are underestimated. You know the way we are in Nigeria, we like to really rugged things. Let me use that word. So, and the pain is not so much. It's not that serious. Especially a woman in labor or a pregnant woman. Let me not say she's in labor. She's pregnant. Just try to rugged it. Oh, we can be able to bear the pain or whatever it is. So they underestimate the symptoms. Number one, they are waiting for family members. This is so common. I have had in my early years of working in the hospital, I have had mothers fathers, husband, wives waiting for relative, maybe the mother-in-law, father-in-law, whoever it is, to come and give permission for certain things, or to come to the hospital and get them be and start praying or something before they take the woman to the hospital. Tell me why. Like, why would you do that? This woman is already in labor. You don't even know what's going on inside her body, inside her system. You are delaying the process. That's another very common reason on delay in deciding to seek care. Another reason is traditional home remedies. You know, in home birth is quite common in the western part of Nigeria, but in Nigeria, it's common, no, but it's quite risky. Why? Because a lot of people have not really gone through that process, training actually, to learn how to manage home birth. So taking home birth in Nigeria just to save cost, for example, is very risky, not only to the mother, but to the child. But it is very common. It is very, very common. And they try several other home remedies. Let's say, maybe, for example, with the case I mentioned, the woman was bleeding. You might be thinking of other ways to try and see to manage the bleeding. Most of the time, you may not be able to, especially when you don't know where the bleeding is even coming from. Another reason is, which is the most obvious one I'm about to say, money. Money needs to be gathered. Let me talk about this part. You know, I think it was some years ago, there was a video that was trending in Nigeria about a woman and her husband that were going to the hospital, and they were making videos, and they said they got to one hospital and they said they had to deposit 500,000, and the husband and the relative were shouting something to the hospital that, why can't you treat first before asking for money? When I was watching that video then, when it was trending, one of the first questions I asked when we were having discussion was, they had, let me say, roughly 7 months or even 8 months. Why? Because maybe the woman didn't find out she was pregnant maybe after 6 weeks or 10 weeks, which is possible. So we are saying, let's say she had like 7 months or even 6 months for the pregnancy to get to that age of maturity for delivery. 6 months for me, I think, is enough to put some form of money together. That's one. Number two, before you, I think, and I'm an advocate for family planning, not necessarily the contraceptives, but planning family. It is very important to have conversations and discussions about when you want to give birth. I mean when you want to start trying. Okay, we get pregnant now. What's going to happen? Should we start saving money? What are the things that we want to do? What are the tests that we want to take? And so on and so forth. It is very important to start having that conversation. You can't start having that conversation while she's in labor. And it's quite common. This issue is quite common with a lot of Nigerians, and we need to stop it. In 2026, we need to start planning pregnancy and planning our family effectively. I spent most part of my years either paying for medical bills or treating people for free, or dealing with mothers that we abandon their babies in the hospital because they cannot afford to take care of the child mentally, physically, emotionally, financially. So I don't see the reason why you did not plan before you got pregnant. You got pregnant. Why can't you start planning financially during the period? Why? So those are some of the challenges that we deal with and things that causes delay in deciding to seek care. So now let's move to step 2, or delay 2. That's delay in reaching care. This one is also another challenge we deal with in Nigeria. I'm breaking this down so that, again, the idea is to create awareness. Because there's some things that we've really not spoken about. We just blame left, blame right, but we need to really talk about it. So the second one is delay in reaching care. About delay in reaching care, the first thing is, which I said earlier, the hospital may be far, which is also very common. The hospital where the mother has been going for antenatal is very far, and it's an emergency. We're in a country where 80% of people are living below poverty line. So you already know what's going to happen. Getting there is a challenge. Hospital is far. Number 2, roads will be bad. Number 3, transportation may not be available. whatever form of transportation, even the money for the transportation may not be available. Number four, which is also common, referral systems may be weak. Let's say she registered in a in a public health center, which is quite common in Lagos, Nigeria. She registered in a public health center. In that public health center, they do antenatal, but they don't take delivery. It is common. I worked in a public health center that does antenatal but does not do delivery. So let's say that's even the case. Referral system may be weak. Next thing, minutes will turn into hours. And when I say hours, not 1 hour, 2 hours, I'm saying even 10 hours, 6 hours, long hours. And in delivery or in obstetrics, hours, time is very, very important. Next form of delay is delay in receiving the care. So she has finally gotten to the hospital. Number one, there might not be available doctor. And most of the time, this type of cases always happens in the night or in the evening. May not be available doctor. No blood for transfusion. Yes, I can tell you for a fact. I had a patient, it was many years ago when I was doing my house job, and the woman died. Summary, the woman died, but the point I want to drive out from the story is the fact that she came in late in the night, 9 p.m. I knew, and I was on night shift. I knew my night shift was going to be a long day when they called me for the case, because they came in. They said it was IUFD brought in, and the child was already intrauterine fetal death, and the woman, she was already going to hypovolemic shock. We needed blood. When I went to the blood bank myself, no blood. What's the next thing to do? You see that I donate blood myself. And I'm saying that because I'm O positive. So that I donate blood myself or start running etasketa to be looking for blood. Husband ran away. I'm putting several pictures of the challenges that we get to see and challenges that are happening currently, still happening right now in Nigeria. So because of all the long delays that happened, the woman actually died. So no blood for transfusion, no operating theater, or there's no lights, there's no generator, no fuel in generator, equipment is not functioning. This is I mentioning are things that are very common, or overcrowded facility. So there's an issue with triaging, knowing which case an emergency, or trying to figure out how to manage the triaged cases. You see the challenges I am listing out. And the system itself, that's the healthcare system or the hospital, is already overstretched. So what do we do in this case? Okay, now let's talk about, so I've painted the picture of the delays. Now let's talk about some things that tend to affect also or cause maternal death in Nigeria that we don't really talk about, and it's very common. Culture. Culture is one thing that I would say that sometimes has really killed a lot of people. Again, I am not bashing any culture. I'm just explaining the facts, and I'm also explaining from experience. Culture in one case. In some settings, we see that a woman will need approval from her husband. Again, I have experienced it. When I mean I've seen it. Needs approval for her husband to maybe seek care, maybe prolonged labor, and the woman we have to take her in for emergencies. Yes, we always need a consent, either from the husband, especially from the husband, if she's married and the husband is available, or a partner, or you understand, the husband. I had a case where the husband said no, that God forbid, that the woman cannot do CS. The mother-in-law said the same thing too, God forbid, the woman cannot do CS, that she will give birth like the Hebrew women. I didn't want to go into that conversation. Let's never enter that Hebrew women conversation. First of all, I was shocked. I was almost going. That is where sometimes they will say, yes, women, we like to apply emotion, because I was almost applying my emotions there to say, I will go ahead and do it without. But as a professional, you have to now list and give them the options and the implications that will happen if this woman says she cannot push this baby. Guess what? The woman even said it. She said it that she cannot push. She don't have the strength to push the baby. The husband kept insisting that she must push. So that cultural issue where women have to seek permission about, especially when it comes to childbirth, about deciding making the husband decide if she should push or not, if she should do CS or not, if she should do one thing or not. I think we need to look into that. And we need to look into that as soon as possible. We need to give women the right to be able to make certain decisions. Yes, you can have that conversation, but better still, maybe have the conversation earlier. I always say have conversations earlier. It's very important to have conversations earlier. It's not when the problem is there you want to having some certain conversations. Most times it may not go in your favor. Have conversations earlier that, oh, God forbid though, but if this happen, do I have the right to decide I'm going to do CS or go in this route or go in that route? So you are mentally, physically, emotionally prepared and aware of whatever it is you're getting yourself into. Another cultural weight or issue is that they expect women that labor is expected to be endured quietly. Have you been to the hospital? You can't endure labor quietly. Have you heard women screaming? How is that quiet? I mean, the common thing that I hear, you have to labor is supposed to be endured. Endure it quietly. You're a woman. Your body was designed for this. Really? Really? Do you know the amount of complications that happen during childbirth? So women go blind. So women go bald. So women have acne that does not. So many things. Some women die of pulmonary embolism. There's so much that happens to the woman's body during pregnancy and even during delivery. So how is that silent? Why should the woman be silent? The next thing is, oh, hospital delivery is sometimes seen as unnecessary. I spoke about it earlier. Let's do home birth. In a country where we've not even trained ourselves on how to do home birth, we are doing let's do home birth. Why? And there is this also I've mentioned earlier, this financial pressure that comes. It's a cultural thing. Financial pressure sometimes can be a cultural thing that comes with it, where some family, like I said, choose home birth because it's cheaper. They forget the complications. They forget that there is no training. They will call somebody that they think had some form of experience, maybe did one delivery of some sort, forgetting that every woman's body is very, very different. And also bear in mind that when the woman dies, most of the time the woman actually dies and then gives birth. Some cases the woman and the child dies. But when the woman dies, the child has to grow up without a mother. There's that gap already. And aside from that child growing up without a mother, somebody died. Death is not something we should just take as, well, it's part of life. But if it's a preventable death, why not prevent it? Now let's talk about what needs to change. In this channel, we always talk about change. After we listed out the problem, we have to provide solution. What needs to change? Number one, I always talk about providing stronger primary healthcare system. I worked in the primary healthcare system for years, and trust me, I know that we can do better. And I know how I was able to manage that healthcare system I was working in, to be able to not just provide antenatal services, but to do an early referral system or channel. So in cases of complications and all that, we need to continue. I don't know if people are still doing that, but we need to continue doing that. Please and please, if you're a doctor or a nurse that work in a primary healthcare system and you know that healthcare facility, primary healthcare center, is not able to take normal delivery or even CS, start doing early referrals for these women. Start telling them when they come for antenatal that, oh, this is where you will do your delivery. Oh, so we're going to start doing early referrals so that maybe the last two antenatal sessions, they can have it in the facility where they're going to be doing the delivery, either normal delivery or CS. It is very important. I did that. I think we need to bring that back if we remove that early referral system and strengthening the primary healthcare facility to be able to carry out some of these procedures, especially normal deliveries. Number two, better antenatal education. I have always been an advocate for men attending antenatal. If you're a man and you're watching this, yes, I said it. I have always been an advocate for men attending antenatal sessions. Might not be all, oh, attend one or two. Let them even play the delivery videos for you, both CS and both normal delivery, so you watch and see. Come and hear the things your wives or your partner is hearing about this delivery. She's not the only one carrying the pregnancy alone. She will always say we are pregnant. Yes, go through the process too with her. I've always been an advocate for that. It will go a long way and it will help a lot. Why? Because the information the woman is receiving, the man is also receiving it, or the guardian and whoever it is that's going to be assisting the lady during the delivery phase is also receiving that information firsthand. Our antenatal system needs to be built in that way. It's not only for women. Men need to attend. We need to have sessions for men too, sessions for the guardian, sessions for whoever it is, the next of kin or whoever it is going to be accompanying that woman. We need to have a better antenatal system. It's very, very important. Number 3, affordable maternal care. Affordable maternal care. There were several things that I did to really ensure that women, when I was working in the health sector, and I did this through the primary health care center. That's the reason why I feel like if we take advantage of the healthcare of the primary health centers, would really help a lot of women. Where I went to the local government and I started soliciting and advocating for affordable maternal care services for some of these women that I knew when they were coming for antenatal may not be able to afford to maybe pay or buy the things for the delivery or so on and so forth, or pay for CS, to see how we can subsidize the amount. And I was able to do that during that time for several women, and they were able, the one that had subsidized normal delivery even free, and the one that also had subsidized CS or even free CS. So we need to do more of that. Providing subsidized maternal care service. Reliable blood bank is the next thing. More trained midwives and obstetric providers. We need to make that available. And emergency preparedness. In my early days in medical, in working in the hospital, we used to have these meetings where we come and talk about mortality rates and so on and so forth. I don't think they do it anymore in hospitals. We need to bring that back. Where we have meetings in the hospital and talk about, oh, how we could have prevented this death, what are the things that could have been done, what are some emergency steps that we need to take, maybe the emergency department, in the ward, and so on and so forth, to help ourselves. I keep saying that government is not our problem in this country. We Nigerians, we are the problem. And since we are the problem, guess what? We are the solution. And if you can apply all these things which I mentioned, and all these things does not require a lot of money. So you don't say, oh, we need to create one special budget for it. No. These are just doctors, nurses stepping up to do what they are supposed to do to prevent these deaths. It is very, very important. We need to get women to not just to empower their voice, but to give them the ability to speak up and say, oh, this is what I want, this is what I don't want. And give them the options. Not make them feel powerless or feel weak because of one reason or the other. This is very important. Lastly, I know this has been a very long and important topic, but it is very, very important. I'm speaking now to my Red Tribe and also to women that are watching this. Seek urgent care if you're a pregnant woman. Seek urgent care if you've had previous history of vaginal bleeding, severe headache with blurry vision, swelling of the face and with high blood pressure, convulsion, high fever, reduced baby movement. These are emergencies. Please quickly seek care and seek that care. And it's important, if you don't attend antenatal, I'm going to say this to you, it's important to attend antenatal care and have these conversations during your antenatal sessions. These are ways that we can prevent maternal mortality in Nigeria. It's not rocket science. It is easy, it is simple. It doesn't require a lot of money. It just requires you and I to be much more proactive. You and I to be much more passionate about what we do in the healthcare system. You and I to create more awareness about what I just shared today, and so many other things that can be talked about, to help these women, to help us as women, because I'm a woman, to help us as women in ensuring that we are safe and we are cared for. Thank you so much for watching today's episode. If you have any question, or if you have any story, or you have anything you want to share, just leave it in the comment section, or you can send a DM and we'll definitely talk about it. See you in my next episode. Bye.